Today's topic is critical for every senior over 60. These 7 heart attack survival tricks could save your life. As age increases, the heart becomes more sensitive to stress, blocked arteries, and sudden changes in blood flow. In an emergency, especially when someone is alone, the right actions taken in the first few minutes can make the difference between life and death. The first and most important point is learning to recognize early warning signs. Chest pressure, shortness of breath, pain spreading to the arm or jaw, cold sweats, or sudden weakness should never be ignored. These symptoms are the body's alarm system, and the faster they are understood, the faster life-saving action can be taken. The second point is maintaining calmness. Panic makes the heart beat faster and increases oxygen demand. A steady mind helps the body stabilize. This leads to the third point, which is controlled breathing. Slow and deep breaths help improve oxygen delivery and reduce stress on the heart during those crucial moments. The fourth point is immediate communication. Always call emergency services the moment symptoms appear. Time lost is heart muscle lost. Seniors living alone should keep a phone nearby or set quick dial emergency contacts. Fifth, if previously advised by a healthcare provider, chewing a standard aspirin can help slow the clotting process. This is only safe if the person is not allergic and has no medical restrictions. The sixth point focuses on body position. Sitting upright with support helps improve blood flow and reduces strain on the heart. Lying flat can make breathing harder, while sitting with the chest elevated keeps airways open. By understanding these survival techniques, seniors can take control of a very dangerous situation. Knowledge, preparation, and quick action are powerful tools that protect the heart and save lives. Recognizing early warning signs quickly is one of the most powerful protections a senior can have during a heart emergency. As the body ages, symptoms may appear differently than they do in younger adults, which is why awareness becomes even more important after 60. The heart often sends signals long before a major event occurs, but many people ignore them, hoping they will pass. Chest discomfort is the most common sign, but it does not always feel like sharp pain. It may feel like tightness, pressure, heaviness, or a squeezing sensation that slowly builds. Some seniors experience discomfort in unusual places such as the jaw, back, neck, shoulders, or left arm. Shortness of breath, even without chest pain, can be an early warning that the heart is struggling to pump blood effectively. Another critical sign is sudden fatigue that feels out of proportion to your activity level. If simple tasks such as walking to the bathroom or climbing a few steps suddenly feel exhausting, the heart may not be getting enough oxygen. Cold sweats, nausea, dizziness, or a sudden sense of uneasiness should also never be ignored. These symptoms are especially important for seniors living alone because they may be the only indication that something is wrong. Paying attention to patterns is equally important. Symptoms that come and go, especially during activity, can signal early blockage of the arteries. Quick recognition allows immediate action, which can significantly reduce the risk of severe heart damage or complications. Staying calm to prevent worsening heart strain is one of the most important actions a senior can take when heart attack symptoms begin. The moment panic sets in, the body releases stress hormones like adrenaline, which make the heart beat faster and harder. This increased workload can speed up the progression of the heart attack, reduce the amount of oxygen reaching the heart muscle, and worsen the overall damage. Remaining calm is not just about emotional control, it is a physical intervention that directly protects the heart. When a person stays mentally steady, the breathing becomes more controlled, the muscles stay relaxed, and the nervous system avoids going into a heightened state that intensifies symptoms. A calm state allows clearer thinking, helping individuals make smart decisions, such as calling emergency services immediately instead of hesitating or doubting the symptoms. Seniors who panic often waste precious minutes trying to move around, search for items, or convince themselves that the discomfort is just indigestion or fatigue. Calmness prevents unnecessary movement, which is important because physical activity during early heart attack symptoms increases the heart's demand for oxygen at the very moment the oxygen supply is reduced. Slow, steady breathing is a powerful tool in these moments. It reduces anxiety, stabilizes heart rhythm, and allows better oxygen flow to the bloodstream. Even simple steps like closing the eyes briefly, focusing on inhaling through the nose, and exhaling slowly through the mouth can create a sense of control. This calm approach creates a safer environment for the heart until medical help arrives. Using controlled breathing to stabilize the body during the early signs of a heart attack is a simple yet powerful technique that can help protect the heart until medical help arrives. When the heart is under stress, the body often reacts with fear, rapid breathing, and a sense of urgency. This fast, shallow breathing reduces oxygen levels, increases anxiety, and forces the heart to work harder, which can make the situation even more dangerous for seniors. Controlled breathing works in the opposite direction by slowing down the body's response, increasing oxygen intake, and calming the nervous system at a time when stability is crucial. The goal of controlled breathing is to create a steady rhythm that allows the lungs to expand fully and deliver more oxygen to the bloodstream. A slow inhale through the nose followed by a longer exhale through the mouth helps reduce tension in the chest and improves airflow. This breathing pattern activates the body's relaxation response, lowering stress hormones and reducing strain on the heart. It also helps steady a racing pulse, which is especially helpful when the heart is already under pressure. Practicing controlled breathing in advance can make it easier to use during an emergency. Seniors who regularly include slow breathing exercises in their daily routines often find it easier to stay composed during stressful moments. Even in the middle of discomfort, focusing on each breath gives the mind something clear and simple to follow. This focus limits panic, supports stable circulation, and helps maintain better mental clarity when quick decisions are needed. Calling emergency services without delay is one of the most critical actions a senior can take the moment heart attack symptoms begin. Every minute that passes without medical support increases the risk of serious damage to the heart muscle because blocked arteries continue to restrict oxygen and blood flow. Many seniors make the mistake of waiting, hoping the pain will fade, or thinking it is just gas, fatigue, or stress. This hesitation is dangerous because heart attack symptoms rarely disappear on their own, and delaying treatment can lead to life-threatening complications. Immediate communication with emergency services ensures that help is on the way before the condition worsens. When a senior calls for help right away, medical professionals can provide life-saving care even before reaching the hospital. Emergency teams are trained to manage chest pain, monitor heart rhythm, and administer critical treatment that improves survival. Quick action also allows the medical team to prepare the hospital in advance, reducing delays once the patient arrives. Seniors living alone must keep a charged phone within reach at all times, especially near the bed and common sitting areas because heart attacks often occur during early morning hours or while resting. Calling emergency services is not just about getting transportation. It is about activating a rapid response system designed to protect the heart during its most vulnerable moments. Even if symptoms feel mild or unclear, it is always safer to make the call rather than take a risk. Early communication ensures the fastest possible intervention, which greatly increases the chances of recovery. Taking aspirin safely, if medically allowed, can play an important role in slowing down the clotting process during a heart attack, but it must only be done when a healthcare provider has previously confirmed that it is safe for the individual. Aspirin works by reducing the ability of blood platelets to clump together, which helps prevent a clot from growing larger. For seniors, this action can sometimes buy valuable time until emergency medical care arrives. However, aspirin is not safe for everyone, and this is why medical guidance in advance is essential. People with allergies, stomach ulcers, bleeding disorders, or those already taking blood thinners may be at risk of serious complications if they use it without proper approval. Many seniors misunderstand aspirin and treat it like a casual pain reliever, but its effect on clotting makes it a medication that needs caution. Understanding when it is medically allowed helps prevent dangerous misuse. If a healthcare provider has previously advised that aspirin is appropriate in a heart emergency, the senior must already know the correct dose and form. Preparing this information in advance is important because confusion during a stressful moment can lead to errors. Having aspirin stored in an easy-to-reach place can also make a difference, as heart attack symptoms often reduce mobility or create sudden weakness. The key is preparation and knowledge rather than guessing in the moment. Seniors should discuss this with their doctor beforehand, understand their personal risks, and follow only what has been medically cleared for their individual health needs. Positioning the body to protect blood flow during a heart attack is a simple but highly effective step that helps reduce strain on the heart and supports easier breathing. When symptoms begin, many seniors instinctively try to lie down flat or move around in search of comfort, but both actions can make the situation worse. Lying flat can cause difficulty in breathing, while unnecessary movement increases the heart's demand for oxygen at a time when blood flow is already restricted. The safest position is to sit upright, preferably on a firm chair or supported against a wall or cushion. This position allows the chest to expand more easily, improves airflow into the lungs, and reduces pressure on the heart. Keeping the legs relaxed and slightly bent without crossing them helps maintain steady circulation. Crossing the legs or tightening the muscles may reduce blood flow and make the heart work harder. Remaining still is equally important because any physical effort, even small movements, can increase heart strain. Seniors should also avoid leaning forward too much, as this can compress the chest and limit breathing. The goal is a balanced posture that supports both stability and comfort without adding physical stress. Having a designated safe spot at home, such as a sturdy chair or recliner, can help during emergencies. Practicing this posture in advance can make it easier to remember during a stressful moment. Proper body positioning keeps the airway open, helps maintain oxygen flow, and reduces the workload on the heart, giving the body a better chance to stay stable until medical help arrives. In moments of emergency, especially for seniors living alone, knowledge becomes the strongest form of protection. The simple steps shared in this video are not complicated medical procedures, but practical actions that any senior can remember and apply when it matters most. Recognizing symptoms early, staying calm using controlled breathing, calling for help without hesitation, following medical guidance on aspirin, and positioning the body safely all work together to support the heart during its most vulnerable time. These small decisions can create a powerful difference in the outcome of a heart attack. Every senior deserves to feel prepared rather than afraid, confident rather than confused, and protected rather than helpless. Taking a few minutes to understand these life-saving techniques is an investment in your safety, independence, and long-term well-being. Share this information with someone you care about, keep emergency numbers close, and stay mindful of your body's signals. The more prepared you are, the stronger your chance of staying safe in a critical moment.